Proximal femoral fracture include head fracture, femoral head fracture, femoral neck fracture, trochanteric fracture, and subtrochanteric fracture. Globally, by 1990, there were 1.3 million of hip fracture globally, and this number is expected to increase to about 7 million by 2050. United States, they have yearly 250,000 hip fractures, and it's cost the budget more than $17 billion. So this is a global health problem with a considerable rates of mortality and morbidity, and the mortality rates reach up after hip fracture about 40%, and some reports from developing countries report up to 50% 1-year mortality. Most of these patients didn't return to their pre-injury level of mobility and ability. The cause of hip fractures, either it is low energy trauma falls, especially in elderly patient, or can be high energy trauma in young patient. Another entity could be a pathological fracture like neoplastic or bisphosphonate fracture, atypical femoral fracture. Diagnoses include clinical, radiological, plain X-ray, anteroposterior, and lateral view, but up to 10% occult hip fracture need to be diagnosed by MRI. So MRI is the gold standard to diagnose occult hip fracture, which present in about 2 to 10% of proximal hip fracture. Management should be a multidisciplinary approach, address the underlying medical condition, early surgery, appropriate surgery, early rehabilitation, pain treatment, and the prevention of delirium. This is the goals of treatment of hip fracture, especially in elderly patients. And it should include perioperative management, should include thromboprophylaxis, also prevention of bleeding intraoperative, and prevention of delirium, and the pain management. Delay in management will end with higher complication rate and mortality rates, and inappropriate management of suboptimal treatment will end with debilitating complications such as AVN, metal failure, non-union malunion. So in summary, hip fracture is not a simple fracture. It is a marker of a global health state of deterioration. Modern hip fracture is a multidisciplinary effort. Incision perioperative aspect of our pain management, early mobilization, early rehabilitation, early surgery, and delirium prevention. So management of hip fracture cannot be limited to the operating theater. This is should have a pre-operative, intraoperative, and post-operative management to have the best functional and outcome. So today we have a webinar in proximal femoral fracture. We here honored to introduce 3 eminent speakers in the field of hip and pelvic fracture care in Egypt. Dr. Mahmoud Badran from Assiut University will talk about femoral neck fracture. Then Dr. Professor Muhammad Abu Saud from Cairo University will talk about trochanteric fracture. Then we'll end with our Professor Hossam will talk about subtrochanteric fracture. Then we will have a time for question and answer. Please, all audience, prepare your question from now. You can write it in the chat box. At the end of our lecture, we will answer. Each lecturer will answer your question. So when listening to each lecture, please write your questions. We will answer it at the end of the webinar after the 3 lectures.